in the series of the Covid-19 Pandemic Quality and Safety Tools. I'm Peter Lachman, CEO of International Society for Quality in Healthcare, ISQua, and lead QI faculty at the Royal College of Physicians. In this lesson, we're going to really look at a key or fundamental part of patient safety, namely situation awareness. You may recall that in the talk around about patient safety, I said there are a number of key elements of patient safety that we need to take into account, starting at individual responsibility, an incident management system so that we can learn, an understanding of human factors, ergonomics, and I used the SEEPS model for that, understanding of systems theory and how we interact with each other, reliability theory, which gives you ways of producing the right care the first time and every time, and then situation awareness, which is knowing what happens in real time and making plans to mitigate against any risk that you may identify, and finally safety 2 and resilience. In this talk, I'm going to concentrate on situation awareness. In the last talk, John Brennan spoke about the importance of psychological safety, and psychological safety enables people to speak up at any time about any risks that they may have identified. Situation awareness, or knowing what is going on in real time, was first defined by Ainsley as the perception of elements in the environment within a volume of time and space, comprehension of their meaning, and projection of their status in the near future. He studied soldiers in the First World War, and the concept of avoiding friendly fire, i.e. not shooting your own soldiers, meant that you had to have situation awareness and know where your troops were at any time. This also applies in many sports. How does the fly half know where the scrum half is? Or how does the tennis player anticipate the next shots of the opponent? Likewise in chess, the chess player has situation awareness and is constantly predicting what may happen in real time. And when they lose the situation awareness, that's when errors occur. For us in healthcare, we need to see it in terms of the human factors approach, and I've put up again the SEEPS model from Pascal Carrion. This shows that we have to understand what's happening in the work system, the tools and technology we need, the organization, the people we have, internal environment and tasks, how we perform in our processes to get the outcomes that we need. So situation awareness in healthcare is about moving away from reactive care to proactive care, being aware of what's happening around us, whether we're at risks to ourselves or to our patients in real time, not past time, actively thinking about what is happening, integrating information from all different sources, and then anticipating what may happen so we can take action to mitigate any problems. This is particularly important in preventing deterioration, which is unexpected, but usually deterioration can be predicted if one looks at all the evidence that's available. So you are aware where you are, what you're supposed to be, and whether anyone around you is a threat to your health and safety or to the safety of the people in your care. There are a number of ways of doing this, and I'm going to give one way that allows you to predict individual situation awareness and facilitate it, called the SLAM process. The first thing is to stop and think. Engage your mind before your hands and before your task. Look at the task at hand and consider the hazards and risks to you, the patient, and share this with the team if there's something that needs to happen. You do this by assessing the work system and the hazards to you, and that is by looking at the work system in terms of the human factors model that I provided earlier of tools and technology, organization, persons, tasks, and internal environments. And then you have to manage it. Stop, share, ask for advice, and devise actions that you may mitigate the risk so harm is prevented either to yourself or to the patient for whom you're treating. Situation awareness requires gathering of information. We need to move away from I know best what's going on to everyone has a different viewpoint, a different lens, and sees the patient and risk through a different opportunity of understanding. You have to recognize and understand all of this and then anticipate what will happen. So level one is the gathering of information so you can have perception. The nurse sees the patient from a different view from the doctor. The physiotherapist and occupational therapists have different viewpoints. And so often we are told when a patient collapses, someone says, I thought something was wrong, but never had a voice to express it. So this is where the gathering of information is so important. We then have to comprehend, really understand, what does all this information mean? It's more than just vital signs. It's soft and hard signs that are important. And that will lead to a projection. And the projection is what may happen in the future and is something required to prevent that happening. A decision, an action, and a worldview that is shared by the whole team. This is the importance of situational awareness. The whole team comes to a shared understanding of what is happening to the patients, what is happening in the work environment in terms of staff, what is happening in terms of the tasks that are required, etc. So we introduced the Huddle as part of a program to improve situational awareness, and we've been running the SAFE program, first in the United Kingdom at over 50 hospitals in pediatrics, and now in Ireland, and we've had 20 teams learning how to use the Huddle in order to facilitate situational awareness. Once remember, the Huddle is merely a tool to enable people to share information and come to a shared understanding and then to predict what may happen. And this is very important because the Huddle is not the end. It is only the means to gain situational awareness. And in the Huddle, we assess and identify people at risk, whether they be at staff, the team, or the patients. We then mitigate that risk, and it might mean we have to take some actions right there and then, or we have to escalate to a higher level of care. And this is what, for example, a patient deteriorating being escalated to high dependency or to intensive care. And in the Huddle, what one's doing is looking at the organization, the internal environment, the people, the tasks, and the technology. And one is assessing whether in any of those areas are there risks. So, for example, assessing whether or not everyone can do the task at hand, have the equipment. In this case, if COVID-19, has everyone the right PPE? And are they able to use it and don themselves correctly? And do they know the procedures, etc.? If you have a new member of the team or a person in the team who is doing a job that they don't normally do, so for example now, we have many team members who are not working in the same place they used to work, they're not part of the procedures. Do they know how the organization of that team works? And do they know how to complete the tasks, etc.? So this is the most important thing that one can do in order to gain situational awareness, and this will increase the safety you have in your clinical area. The huddles generally are planned as short, brief meetings lasting about 10 to 15 minutes maximum, standing up and discussing the problems brought together, happening 2 or 3 times a day. We normally said in the morning after the ward rounds, late afternoon, and then in the middle for the evening shifts around about midnight. So every 8 hours is a very good time to do huddles and to share information and assess the safety of the ward. This is because we want to anticipate. Now, of course, with social distancing, it's more difficult. So one can do huddles with keeping distance from each other, or one can use phones or tablets or do telephonic huddles. The key is sharing information, and this is really what we have to do, because if we do not share information, then we will not have safety after all. So key elements of a huddle or gaining situation awareness is that everyone's opinions accounts. From the lowest in the hierarchy to the highest, there's equality at that point. We have to respect all views and ensure that everyone has a chance to speak up, and we have to include the views of the patients and their families. So this means hierarchy changes. In the psychological safety talk, you have heard of the importance of respecting everyone's views and listening. So it may well be that the nurse knows more than the doctor in terms of what might be happening to the patient. And that is why we have to listen to all. And the person who is conducting the huddle, where we're gathering this information, where we are then comprehending and planning what may happen, needs to take this into account. Now, there is a framework for real-time safety devised by Charles Vincent and colleagues at the Health Foundation, and I've used this in the huddles in order to ensure that we cover all areas of patient safety that we discussed 2 lectures ago. The first thing is we need to see what are we doing well, what has happened in the shift that worked really well, because we want to continue doing this. As Holnagel says, some days we do the same thing and we get a good outcome, and other days a poor outcome. So what we want to do is study what we did well so we can try to predict what makes sure that we get good outcomes. We need to, in real time, study any past harm that we may have. And in this case, what we do is ask the clinical teams in their own clinical areas to identify potential harm to their patients or to themselves. So, for example, in a care of the elderly ward, one will be looking at harm such as falls, medication harm, pressure ulcers, delirium, medications that could be not given on time, nutrition, etc. So you identify the harm, and in this part, one asks, was anyone harmed in the last 8 to 12 hours? So we're not waiting for this to go into a long investigation of reported. We want to fix things in real time. We then ask about reliability of the service. Are we doing what we're supposed to do? Are we going through the guidelines as we said, standard operating procedures, or are we deviating? And if we are deviating, why? I think that one has to standardize where possible and deviate when necessary, but one needs to study it in real time to understand your process as well. We then look at the sensitivity to operations, which is the SEEPS model, looking at the different tasks and equipment, etc., that we have in order to complete the work. And then we get to the anticipation. This is predicting what's going to happen based on all the information that we have come on, and that gives to learning. This is all tied into the model of human factors, looking at the work system, how it's working, looking at our processes to see if they're reliable, looking at our outcomes to see if there's something that we desire or something that is undesirable, and fixing this in real time. And that's what the Huddle allows you to do, as long as you do have a structure. And that's why I'm tying this all in to the understanding of your work system and how the processes are conducted within your work system. So real-time risk management is basically like this. You identify your harms and risks in your clinical area, whether it be to you or to the patient or to the team. You know what you're doing well so that you can replicate. You know who your team are. They're the front line who deliver the services, and that's very important because they can often solve the issues that we cannot solve outside the service. You have to know the patients, the risks they have, and then you have to anticipate and mitigate. So we looked at a number of issues that are important for you to look at and to identify so that you can see which patients are at the highest risk. Whenever there's a family concern, you must be worried. Families see their family member who's in hospital in a different light, and they know best. High-risk medication or therapies are often what we are using right now, and we need to understand that patients who are on unusual therapies are at higher risk of medication harm. The early warning score may need to be changed and may need to be looked at from a different light, but one that's going in the wrong direction is one that we should worry about before it gets to the red zone. Any communication concerns are important. Now with PPE, that is a major issue, as well as if people are speaking different languages or they're different team members and we haven't got formal communication methodologies. We like handoffs to use something like IPASS and SBAR for communicating between teams. If there's more than one clinical team involved, one could have problems because we're not sure who's in charge. And if a person is in the wrong bed, i.e. not in the ward where they're supposed to be, and this is going to be a problem right now, then we have to have heightened awareness. And finally, patients who are not getting better they should, not as predicted in the last huddle, are ones that we need to worry about. So these all are very important. And the final one is a patient who's just not right. The feeling of nurses, and despite normal vital signs, is just not right. These patients are often called watchers, but the patients we identify, we'd like to know are patients we need to watch. And those are get onto either we need to mitigate or we need to observe or raise to a higher level of care. So in summary, the Huddle suite to achieve situational awareness and to understand how our work system is working consists of identifying at the ward bedside huddle, the nurse, the doctor, the parent, the family member, mitigating nurses, doctors, allied professionals, the early warning score, who the watchers are, family or communication concerns, etc., or escalating, and this might need to go to a high level of care in the hospital and having an overview of harm and risk within the clinical areas. I trust that this gives you an overview of situational awareness. If you'd like to learn more, consider coming onto one of our courses that we run at the college. We'll be starting them as soon as we're allowed to in the autumn. And hopefully you'll be able to see that having situational awareness will decrease harm and decrease deterioration in your patients and make a much happier team. Thank you for listening to me. Our next talk will be on safety 2 and resilience. See you then.